So hello, now we will look at the contraindications against giving intramuscular injections to patients with schizophrenia. Contra means we are against giving it. So we don't want to give intramuscular injections to schizophrenic patients when, for example, the patient has severe liver disease, severe kidney disease, or severe blood disease. Blood disease meaning that we have a lower amount of, for example, white blood cells, red blood cells, for example, in leukemia. So in these patients, we don't want to give antipsychotics because it can further lower these levels, and that is dangerous for patients. The same with liver disease. We don't give medications generally when the liver is so damaged, because as we know, most of the medications are metabolized by the liver. So severe liver disease or severe kidney disease is contraindications. Kidney disease, why? Because most of the medications are excreted through the kidney, through the urine, and therefore it can accumulate in the body if the kidney function is very low. So the contraindications are liver disease, kidney disease, and any blood disease. Then, when we're dealing with the heart, if you have a QT prolongation, for example, more than 500 milliseconds, that is also contraindication, because antipsychotics can increase the QT interval, so the beginning of the Q to the end of the T can be increased, and therefore it's dangerous. Even if you have more than 450 milliseconds, then you should watch out, because you should watch and check the QT if it increases or not after giving the medications. So, for example, if it increases more than 20 or 30 milliseconds after giving the medication, then please consider stopping the medication or lowering the dose of it. Then, of course, patients who are breastfeeding, so schizophrenic patients who are, for example, pregnant or are breastfeeding, these patients needs to have the most up-to-date information. That means, so please talk to your gynecologist or psychiatrist, because there exist databases of which medications are good and which medications are very bad and toxic for patients who are pregnant or who are breastfeeding. So I don't mention any medication on my YouTube videos that are related to breastfeeding or pregnancy. Why? Because the information will be up to date in a week or in 2 weeks. So whatever I'm saying today will be outdated tomorrow. So we are dealing with a small baby here. We are dealing with a woman who is carrying her baby. That means it's very important that you always talk with your gynecologist, with your psychiatrist, and you look at the most up-to-date database. And there you can see which medications are contraindicated to give in pregnancy and in breastfeeding. And now, the other part of intramuscular injection is, of course, when you inject the material, you can get an allergic reaction. That meaning you will get skin reddening, you can get urticaria, as we call it, an allergic response. So these patients are hypersensitive to these medications. But usually this does not happen because we know that we need to give oral tablets of antipsychotics before we even consider giving intramuscular injections. So we always start with oral tablets, and there we already see if the patient is allergic to this material or not, so to this medication. So we always start with the lowest dose, and then these skin problems will appear, and then we never give an intramuscular injection. Why? We know intramuscular injections are these have a lot of high dose, so a lot of medications within them that will last 4 weeks or even 3 months. And if you give an intramuscular injection with this stuff that will last for 3 months, then imagine what type of allergic reaction. You cannot have an allergic reaction for 3 months. You see, that's the problem, and it's very hard to remove from the body. How can you remove this stuff? It is injected into your muscle with high dose, and it will last there for a couple of months. And if this patient is allergic to that, then you have a huge problem. So never ever give an intramuscular injection without providing the patient with the tablet for many weeks. And you titrate this up, so you start with the lowest dose and then you come to a good stable level. And of course, the contraindication here when we deal with the stable level is also you only give intramuscular injections when you have a stable level of oral tablets. So never if it's unstable or if the side effects are huge, then you don't give it. For example, we know a Parkinson's disease patient. Parkinson's disease patients have extrapyramidal symptoms. This is a typical sign of Parkinson's disease, extrapyramidal symptoms. Please check that out, what this means. It means, for example, shaking, or it means rigidity, akathisia, or dystonias. I will not deal with that in this video, but I want you to remember that if you have a Parkinson patient, please don't give antipsychotics to it. First, especially not first generation. So the typical first generation antipsychotics like haloperidol or flufenazine have higher risk of getting extrapyramidal symptoms. And if you already have a Parkinson patient who already has extrapyramidal symptoms and you now give antipsychotics on top of it, it can be really dangerous. So please, you have to look at the chart of what diseases the patient has. Also, if the patient is older patient, more than 65 years of age, and the patient is have dementia, on top of that also psychosis. So we have a dementia patient with psychosis that is more than 65 years of age, then if you give antipsychotics, you will increase the risk of killing the patient. So death is increased by patients who have schizophrenia, who are older than 65 years of age, who already have dementia and psychosis on top of that. That is very dangerous. Another interesting point is that if you have younger children, so everybody less than 25 years of age, younger children, adolescents, teenagers, and so on, these people will actually get a higher risk of suicide due to the antipsychotic medication. So you need to monitor this patient. The family members, the doctors need to always check for signs of suicide in these patients. You are allowed to give antipsychotics in patients that are less than 25 years of age, because there are patients with schizophrenia who are less than 25 years of age, but it's important that you monitor any suicidal IDs, any depression, and so on, and then you need to watch out. So that can be a contraindication if the suicide risk will be too high. The patient starts to harm himself or herself. That's a contraindication. So I think this is enough. So Parkinson's disease is a contraindication. Any type of central nervous system disease, any type of brain damage, subcortical brain damage, or any type of tumors or in the brain, any type of coma, so central nervous system depression, any type of liver disease, any type of kidney disease, or blood disease, or QT prolongation in your heart, or patients that are more than 65 years of age with dementia and psychosis, and those patients that are less than 24 years of age and have a high risk of suicide risk already, are showing signs of suicide. Then if you give antipsychotics on top of that, they will maybe kill themselves. So you need to watch out. Okay, otherwise I would say, if you disregard all these contraindications, we don't find any contraindications, then I would say that intramuscular injections of antipsychotics are very, very good. Okay? Because you can look at my other video that is talking about the indications. You will see that the intramuscular injections are having a more stable level in the body. That meaning that the patient does not have to take a pill every day. He can get an injection every 4 weeks or every 3 months even. And that is very good because the compliance is not a factor here. You don't need to consider if the patient is taking the pill or if he's forgetting it some days or not, and so on. And the level in the body will be more stable, and you only need to take a medication intramuscularly every 4 times a year. So that is very, very convenient for the patient also. Thank you very much for listening, and have a nice day.